Hello everyone. In this video, we are going to learn about sinusitis. So, what is sinusitis? It is nothing but infection of the paranasal sinus. Next, we are going on to the types. Now, types, there are five main types of sinusitis. First one being the acute maxillary sinusitis. Next is acute frontal sinusitis, chronic maxillary sinusitis, chronic frontal sinusitis, ethmoidal and sphenoidal sinusitis. Now over here you can see a diagram which shows the difference between the healthy sinuses and the infected one. So you can see the sinuses like this frontal sinus, sphenoid sinus, ethmoid sinus, and also this maxillary sinus. Now onto the latter half, you can see very clearly the inflamed sinus lining along with the fluid which is present. This fluid is nothing but excess mucus or sinus infection. Now let's get to know a little about all the types of sinusitis. So the first one is acute maxillary sinusitis. In this, it is the most frequently affected paranasal sinus. This may be due to its close proximity to teeth. Next is acute frontal sinusitis, where it is less common than the maxillary sinusitis. However, it is very similar to maxillary sinusitis. Next is chronic maxillary sinusitis. Now in this, the sinusitis lasting for more than 1 month is when you will use the term chronic. Next is a chronic infection of the maxillary sinus, which is similar to acute. The next one is chronic frontal sinusitis. Here the pain and tenderness are less severe. And next is ethmoidal and sphenoidal sinusitis. It is less common. However, if it occurs, then in ethmoidal there is pain in eyes, and in sphenoidal there is headache. Now we'll learn a little more about acute maxillary sinusitis. So, etiology about it in age, it usually occurs after the age of 15 years, but it may also affect children aged 5. Now, sex, it affects both the sex equally. Risk factors are nasal infections, dental infections, fungal infections, trauma, blood-borne infections, lowered resistance. Next is pathology. Now, in this, you have five stages. The first one is catarrhal stage. So, in this, initially there is congestion and edema of the mucosa of the sinus and the ostium, that is hypertrophy of the mucus glands. Next is exudation. Now, in exudation, due to increased glandular activity, the secretions they collect in the sinuses, which are mucoid initially. Next, you go to purulent stage. Now, in purulent stage, there is thick mucopurulent discharge which drains out through the ostium. At this stage, the cilia may become paralyzed or destroyed. Now we'll go to next is complication. Now complication, this we will learn about in the upcoming slides. The next is stage of resolution. Now the infection may resolve at any stage depending upon the following factors. So the first one is virulence of the organisms. Second is resistance, which is offered by the body, and the third is antibiotics, which is administered. Signs, there are these four signs. So the first is inspection, palpation, anterior rhinoscopy, posterior rhinoscopy. Symptoms, initially there is discomfort in nasopharyngeal region which may be present. Now these are certain symptoms which a person may experience if he is having or if he is suffering from sinusitis. Next is pain in maxillary region which is present. Nasal discharge is mucoid initially, it becomes purulent, sometimes it may be blood stained. There is blocking of the nose, nasal resonance, dry cough, epistaxis. Investigation, so these are certain investigation tests which a person can go through in order to confirm sinusitis. So the first one is posture test, transillumination test, radiograph of paranasal sinuses, CT scan, endoscopy, bacteriological tests. Now here you can see a diagram or a photo of endoscopic sinus surgery. In this, the endoscope is inserted into the nose, providing the doctor with a very clear view of the sinuses. Next, these are the photos. First one is the photo of posture test. The second one is radio tomograph of paranasal sinus. Next is CT scan, and the last one is transillumination test. Now, next is differential diagnosis. So, in this, there is alveolar abscess, cellulitis of the cheek, insect bite, or angioneurotic edema, infraorbital or trigeminal neuralgia, malignancy of the maxillary sinus, temporal arteritis. Complications. Now, these are certain complications which may occur if sinusitis is not properly treated or not treated early on. So first one is pansinusitis, second is middle ear infection, pharyngitis, laryngitis, tracheobronchitis, ophthalmic complications, osteomyelitis, asthma, and mucocele. Now, management, there are two types of management treatments. First is general, second is local. In general, you have antibiotics, decongestants, analgesics, antihistamines. And in local, you have nasal decongestants, drops, steam inhalation, fomentation, adrenaline. And yeah, that's all for sinusitis. Thank you.